All right. Welcome to this lesson on spine injuries and disorders. You'll need to take out the packet of notes that we have as we're going to finish out the notes together on this last bit of information. So, we're going to go through this slide here that says signs and symptoms of spinal injury. All right, so if someone was suspected of having a spinal injury, these are the things you'd be looking for: pain or tenderness of the spine, any deformities of the spine, like anything sticking out or looking like it shouldn't be there, or a hump or something. Any tingling or pain in the extremities. Remember, extremities are arms and legs. So it is common if you do have a spinal injury that you could it would maybe compress nerves that would run down all the way down your arms or your legs, and it would leave you with some pain and tingling. Loss of sensation or paralysis, which would be more extreme. Incontinence, this would be a much worse injury. Incontinence is when you are unable to hold your urine or feces, meaning you don't have bladder control or bowel control. You could also look for injuries to the head if you're checking for signs and symptoms of spinal injury. Okay, how do you assess a spinal injury? So the first thing you're going to do if you were to see somebody go down and suspect a spinal injury, you would check for the ABCs. So I want you to know what ABC stands for. ABC stands for airway, breathing, and circulation. So you'd want to check their airway to make sure they don't have something blocking their airway. You would want to make sure they're breathing, and you want to check for circulation. And the way you can check for circulation a lot of times is if you press down on a fingernail. So you can press down on a fingernail, it should turn white. And then when you let go of your fingernail, it should come back pink. And so that's a nail bed perfusion test, but it's a good way to check for circulation kind of easily to make sure that there is blood getting all the way to the ends of the fingers and toes. You can also check circulation with pulse. If you know how to check pulse distally, like you would check it in the wrist. And there's also a place down in your foot you can check it. LOC stands for loss of consciousness. So that could be something that you see if someone has lost consciousness and indicate that. If you're checking someone out, you would want to palpate. Palpate means to touch. So you'd want to touch and press around the entire spine to see if anything feels like it's out of place. You can look for signs of injuries. There's this acronym here, and I have this for you on your notes, so you don't have to write anything down, but this is what that stands for. You could look for any deformities, contusions, abrasions, which are scrapes, punctures and penetrations, burns, tenderness, lacerations or cuts, or swelling. So these are all things that you can look for if somebody's injured, and then you would note those things. And again, you could check pulse, you could check motor and sensory functions on all the extremities. Next, we're going to watch a little video about kind of how a spinal injury assessment goes from a first aid standpoint.